say the next on our list is Hep B on our antenatal laboratory investigations. Previously, we talked about the blood group and the resource type and resource incompatibility in our previous video. And we are now to talk about Hep B. That's next on our list. So with the Hep B, it's either negative or positive. So when a pregnant woman visits us the first time or a subsequent visit, we need to run a test, a routine test. And Hep B is one of the investigations. So if you are negative, a pregnant woman, you are safe, meaning you have no Hep B virus in your system. But if you are positive, that is where we need to discuss more and know what Hep B is and the signs and symptoms, the what causes and how we manage our pregnant women when they are Hep B positive. So that's what we are going to discuss on this video. So what is Hep B? What someone will always say, Hep B is a liver infection caused by the Hep B virus. It could be acute or chronic. Um, Fortunately for us, we have the Hep B virus that mostly those who are at risk, who maybe they contacted a person infected with who had a with Hep B virus, they try to take the vaccines, or someone or may be on the vaccines and maybe whilst in the vaccine she was pregnant and when she's due she can also take the vaccine also. So after you being tested positive, there are other investigations you need to do. So before the investigations, we could ask what is the cause of it. One is by blood, body fluids, using or sharing a toothbrush with an infected person, a needle. It can also be spread by sexual intercourse with an infected person, saliva by an infected person, and during birth, it can also be transmitted. So the symptoms sometimes before 3 months, when the person has the virus, it couldn't be seen. So some my pregnant woman may come to your facility, she's okay, but when she is tested, she is positive. So, but some also may have signs and symptoms. That could be jaundice, that's the yellowish skin or eyes, fatigue, abdominal pain, nausea, vomiting, loss of appetite, and dark urine. So, with such symptoms, we need to do a lot of investigations for it. And some of the investigation is the Hep B profile. What would I say a B profile? It is when we are able to detect if you are acute, chronic, if the Hep B is infectious, or you are a carrier of it. So those are the investigations. And afterwards, we do higher investigations also. That is for us to know the viral load in your system, the exact level where you've gotten to. So if your viral load may be higher, then we recommend a liver specialist to you because maybe the liver is being diseased or is being damaged or is getting to that stage. So we need to recommend a liver specialist to you so that he or she can recommend an antiviral medications also whilst you are pregnant. We can also do that. What can we also say? We have other things we also tell our pregnant women. We counsel them more. So this is where the pregnant woman needs to be counseled by her midwife on what to do. One is during birth, immediately the baby is born, within 12 hours or within 24 hours, and her B immune globin needs to be given to the baby. That's within 12 to 24 hours that it needs to be given to the baby. When the baby is also 1 to 2 months, that shot also needs to be given to the baby. And when the baby is also 6 months, the dose also needs to be given. So it's 3 shots within that period so that the baby wouldn't be infected also. Because there's a high possibility, or almost 99% or 90%, that the baby can be infected. So when the vaccine or when the Hep B immune globulin is given to the baby, it could reduce that. And for breastfeeding also, one will ask that, can I, since it is transmitted through blood fluid, can I breastfeed my baby? Yes, you can breastfeed your baby when the Hep B immune is given to the baby. You can breastfeed, but we take precautions, or there is an exception when the mother has the nipple, there is crack, bleeding, or sore at the nipple. With such cases, the lactating mother needs to stop breastfeeding, but she needs to express the breast milk and discard so that there will be continuity of supply of breast milk till the nipple heal. That is when she can continue breastfeeding. So these are the investigation, the heavy investigation we do, and the need for a pregnant woman to take notes about that. Thank you.